Hello, everyone. I hope you're doing well. And today's topic is about a very common sign that we will eventually see as medical students, as nursing students, and other healthcare students. Uh, just concentrate with me, and we will have memorized more than 90% of this video by the end of only watching it. We're going to talk about clubbing, as we said, and clubbing is a type of nail change that occurs in a wide variety of systemic diseases. And we can describe this finger clubbing as you can see. Let's just look at it closely. It can be described as painless soft tissue swelling of the terminal phalanges and increased convexity of the nails. Now, as you see, it usually affects the fingers symmetrically, and it may also involve the toes. But in some cases, it may be unilateral if it's caused by a proximal vascular condition, such as people with an AV shunt for dialysis. Now, um, let's talk about the causes of clubbing. More than 90% of the causes are going to be acquired, and there is going to be a cause that we will find. But in less than 10% of the people or patients with clubbing, it may be congenital, so they're just born with clubbing. Now, some people like to remember the causes of clubbing by classifying them into thoracic, cardiovascular, gastrointestinal, and others. As for me, I like to use the mnemonic in front of you for clubbing to remember the causes, as C stands for cyanotic heart disease and cystic fibrosis, the L stands for lung carcinoma, the U stands for ulcerative colitis, the B stands for bronchiectasis, the B stands for benign mesothelioma, the I stands for idiopathic pulmonary fibrosis and infective endocarditis, and the N stands for neurogenic tumors, and the G stands for gastrointestinal disease. So you just say the word clubbing, and remember that each letter stands out for something specific. As like C, you gotta remember it's cyanotic heart disease and cystic fibrosis. N, remember it's neurogenic tumors, and so on. So just memorize this mnemonic, and you'll never forget the causes of clubbing. Now, how do we assess clubbing, and how do we make sure that the patient has clubbing or see if it is clubbing or not? First of all, we have something called the nail bed angle. Now, as you see in the normal side of the picture, the nail bed should be somewhat straight within 180 degree between the nail and the distal phalange skin fold. Okay, now in clubbed patients, this angle will be increased in more than 190 degrees. Okay, so it normally should be a straight 180 degree angle. In clubbed patients, this angle will be more than 190 degrees. Now, the second sign we look for is something called Shamroth's window. Now, in Shamroth's window, what you do is you ask the patient to place the nails of the corresponding fingers, for example, the ring fingers. You ask the patient, as you see in the picture, to place both back to back ring finger, both ring fingers, place them together back to back, and we look for something called the diamond shaped gap that we see in this picture. This is how it should be in normal people. If you do this test, you'll find that diamond shaped gap. Now, in clubbed patients, this window will be absent, so we will not see a gap between the fingers, and this is called Shamroth's window absent. Now, the third test, which is the least popular, is the nail bed fluctuation. The nail bed fluctuation, as you see also in this picture, what you do is you place your thumbs under the pulp of the distal phalanx. So you place your thumbs, as you see in the picture, on the palmar side of the distal phalanx, and you use both your index fingers, as the guy is doing here, to alternatively fluctuate the nail bed. And if it moves easily, then this is a sign of clubbing. So I hope you, by the end of this video, you know what is clubbing. You know that it's symmetrical. It's a painless soft tissue swelling of the terminal phalanges. We have memorized the causes by using the mnemonic clubbing. And we have known the three most popular tests for clubbing: the nail bed angle, number two is the Shamroth's window, and number three is nail bed fluctuation. Thank you very much for watching this.